I'm Dr. Surya Narayan Mohanty, Senior Consultant and Head of the Department of Obstetrics and Gynecology of Apollo Hospital, Bhubaneswar. Today I'm talking about the endometriosis. Endometriosis is a common disease in case of young patient. Usually it starts from around 13 years of age to almost till menopause also. But during the early part of pain, during the early part of the menarche, usually young patient, they usually complain of pain in abdomen. So once the patient comes in pain with the abdomen, then we have to evaluate the patient. So in case of early part of the female, then we have to investigate according to the ultrasonography. And once ultrasonography diagnose that it is a endometriosis, then we can treat the patient. So different types of treatment, modalities of treatment are available for endometriosis, and in young case the sonography shows that the size of the ovarian cyst is less than 3 centimeter, then we have the medical management for this patient. And if the size is more than 3.5 to 4 centimeter, 6 centimeter, and the patient is having severe complaint of pain in abdomen during the periods, or is not related to periods also, then you have to go for surgical management. And for medical management, we have the research molecule Dynogest 2 milligram. Initially we start with 2 milligram, 1 tablet daily for a period of 1 year or 3 years or 5 years maximum. It can be given 5 years, but now the research is going on and they are telling that it can be given to up to the 10 years. So it is a question is that we have to suppress the endometriosis by suppressing the symptoms of the patient. Once the pain subsides, then you can have a lag period where you can discontinue the medicine and you just monitor the patient for a longer time. And once the patient is in the marriage group, then the most important, once the patient is having the baby, and because most of the patient they have the infertility. So once the patient have a baby, then that part is over. But that doesn't mean that endometriosis is already reduced in the already wiped out from the body, but the endometriosis has to be followed and monitored as long as the patient is in the menopause group. Yeah, when the patient is required for surgery and the size of the endometrium, size of the endometrium or chocolate cyst of the ovary is more than 4 centimeter, 5 centimeter or 6 centimeter, then surgical removal is must. And once it is surgically removed, then to reduce the process of endometriosis, we have to put the patient on tablet Dynogest for a longer period. And the permanent treatment for endometriosis in a elder group, that is when the patient completed a family, then it is after completion of the family, if the patient is having severe pain in abdomen, in spite of giving all treatment, medical treatment, if it is not responding, then we have to remove both the uterus and ovaries. That is the final treatment of endometriosis in elder age group.